good morning. My name is Daruni, anak perempuan Ewin. My metric number is 178977.
Hello, my name is Nurul Nadia binti Muhammad Razi. My metric number is 180554.
Hello, my name is Muhammad Shazani bin Jafri. My metric number is 177308.
Hi, my name is Kasan Alakiswa Jinganesan. My metric number is 179546.
Hi, my name is Ikmal Syami bin Adam and my metric number is 178325.
Hi, my name is Tengku Said Muhammad Syahmi bin Tengku Said Mansur. My metric number is 180687.
Hi, my name is Ililiana binti Kalam. My metric number is 180654.
Hi, my name is Fatih Akila binti Jalaluddin. My metric number is 180418.
So, I will start with the definition of pathology. Pathology is a branch of physical science primarily concerned on the examination of organ, tissue, and bodily fluids in order to make a diagnosis of disease. So, pathology have three types. First is clinical pathology, anatomical pathology, and a combination of two, which called as general pathology. In general pathology, it is described as the scientific study of disease which can be described as any abnormalities that is causing changes in the structure or bodily function of the body. Next is anatomical pathology. Anatomical pathology involves the study and diagnosis of disease based on examination of surgical removed bodily specimen or the entire body, or what we call it as autopsy. The last one is clinical pathology. Clinical pathology concerns the lab analysis of blood, urine, and tissue sample to examine and diagnose disease. Next, Daruni.
Okay, can I explain about internal bleeding?
Yes.
And then normally the clinical signs of internal bleeding is shock, and then shocking may occur if there is enough blood loss to decrease the amount of blood within the circulatory system. The signs and symptoms of shock may include rapid heartbeat, low blood pressure, cool and sweaty skin, and abnormal mental function or confusion. Most healthy people can lose 10% to 15% of their blood supply and show minimal signs of shock. This blood loss is equivalent of donating a pint of blood. Symptoms may become severe as more blood is lost. Children, the elderly, and those taking statin medication may not exhibit classic signs and symptoms. And medical care providers may need to maintain a higher level of suspicion when looking for internal bleeding. So, Fatia, what do you think about pathology?
Since we are talking about pathology in our everyday life, I want to choose acne as what always occur in our young age. Acne vulgaris is the common acne that we have, and it is a skin disorder of the sebaceous follicles that usually occurs in adolescent and young adults. And there are three major pathogenic factors, which is first hyperkeratinization, second stimulation of sebaceous gland secretion by androgens, and the third one is the colonization of propionibacterium, which promotes perifollicular inflammation. And there are the acne can range from mild to severe, as we know. And yeah, that's it. So, what do you think, Kesavan?
Okay. So now we actually discuss about the daily pathology. So I just give a simple example. For example, it's a wound. Wound is actually also classified as a pathological condition. Even a small, tiny wound also can consider as a pathological because it's changed the pattern of the skin and also the skin pattern. The wound also can come in various shape and size. Small can be bigger or small. For example, if you cut your finger, it's actually the shape of the wound is actually called incision. For example, if you puncture your hand with some metal or nail is actually the shape of the wound is actually considered as a stellar, and the wound also can be cause other pathological condition, because if we expose our wound, it will cause to expose to other bacteria, virus, and so many parasites. So it also can cause a lot of other pathological condition which may cause fatal. And if it's a very large wound, or if you accidentally cut your veins or something like that, it can cause loss of blood loss, and it will cause a lot of blood loss and proceed to hemorrhages. And hemorrhages also very serious condition in human, also in animal, and which can cause high fatality rate. And that's all for me.
Can I ask, hemorrhage can cause anemia?
Yeah, can. The high blood loss is also considered as anemia.
And K7, normally hemorrhage occur is mostly at what organ?
Hemorrhage is mostly can occur in organ that have many blood supply. For example, in lung also, lung is a main part of blood pumping system. So any damage that occur at the vessel of the lung, it can cause a serious hemorrhage. So anyone else want to say something else about daily pathology?
Yeah, for daily pathology, I think we can just simply observation, because as a vet, our patient really do not talk to us, right? So we need to develop our observation skill. So for daily pathology, we can observe to our friends, to everyone around us. For example, when someone is coughing, actually that is some microbes in their air passages, which they need to clear out of their passages to the lung. So they cough. Actually, coughing got two types, which is the acute coughing and chronic coughing. And for the acute coughing, there are two also, which is the infectious or non-infectious. For infectious coughing, it can infect, from its name also, we can see it can infect other person. So for example, acute bronchitis with the inflammation at the bronchi. For non-infectious coughing, it is, for example, the allergic and asthma. So asthma really cannot infect to other people, right? So, and lastly, the chronic coughing is a very serious that can damage our lung. For example, the cigarette smokes. So that's all from me. What do you think, Chami?
Before that, I want to ask, what is the treatment can we give if that particular person have cough?
For coughing, I think we do not really learn about drugs yet, but you can go to the clinic and ask the doctor.
Maybe the doctor will give antibiotic.
Yeah. And for coughing, if it can transmit to other person, what type of agent is it transmitting? Is it bacteria, virus?
Actually, what I read just now is a microbe or an organism.
It can be any microorganism, any bacteria, virus.
And Ikman, do you think that coughing can be healing without medicine?
Apparently, yes, if it's not too serious thing.
So, I'm gonna give another simple example. Like, K7 just now is wound or hemorrhage. So I'm going to describe about blister. But then before that, I will give the description of lesion as what we learned that day. There is 10 description of lesion. First of all is the size. The size can be either large, medium, or big. And then another one will be shape. As K7 mentioned also just now, it can be round, can be oval, can be incision. Incision it can be caused by the defensive wound. It's like people want poke you then with knife, and then you try to defend yourself. And then it can be the color, the lesion can be what color, either it's red, blue, white, or others. And then can be the cut surface, and also the distribution is either focal or multifocal or diffuse. And then another example of description of lesion is degree of severity. It can be either mild, moderate, or very severe.
What about the consistency?
There's also consistency. Consistency, you got like friable, soft, firm, and hard. How to differentiate? Soft, you can touch your ear. It's soft.
Yeah.
And then your nose is firm. And then your forehead is hard.
And then Shami, what do you think about location?
Location is consists of two. It's either general location of anatomical location. General location is which organ. Then like the anatomical location is where specifically the lesion is a, for example, it's a kidney. Where is it? It's either in pelvis or medulla or cortex. Then the smell, you can make an analog. It's like a smell of shit. It should smell like dead carcass, something like that. So let me continue with my blister. So blister in pathology also is called, I forgot, hydrophic degeneration. It's like our upper skin containing of fluid is not actually fluid, it's actually serum like. So it can be caused, the major cause is friction, like extensive rubbing to your skin when you all wear tight shoe and all those. And then it also can be caused by extreme temperature, it's too hot, and also it can caused by the chemical exposure. So you can give some treatment like normal treatment, don't let it peel off, and then avoid it with abrasion.
Shami, can blister cause hemorrhage?
Yep, blister can cause hemorrhage if the friction is a lot, and then skin is quite deep, and then it's damage the blood vessel, and then the serum will contain blood also. So that type of lesion is called hemorrhagic blister.
What if hemorrhage actually happen, and how long it will take to heal?
It depends. But then actually, from what I read, you can make it fast, the recovery, by taking a lot of protein. Sometimes it can be up to only 2 days already recovered. So what do you think, Sir?
Just now you said about more to the lesion of the general skin in case of blister. So I'm going to talk more about the ulcerative ulcer or oral ulcer. So oral ulcer is caused by the sharp things that you eat, maybe bone, fish bone, and then it more to the ulcer is more to the erosion of mucous membrane, as in oral we has a mucous membrane, right? So for the lesion that we can found in the mouth with the lesion is for shape, it was round and is very in size. Then the color of the lesion type is more paler than the mucous membrane itself. So lesion is not caused severe thing. It will depend on the condition itself. If you have a stress, so your immune system will decrease. So your body condition is not stable enough. So the agents might be become higher, and it will affect more. So you have a lot of mouth ulcer in your mouth. I think that's all.
I'm sorry to you said just now ulcer is caused by when you eating sharp things, right? So is this actually happen in the digestive tract
fixing the mucous membrane, so it's considered as ulcer. If it's on the skin, it's considered as
Erosion.
erosion.
I want to ask, how do you usually treat the ulcer in your mouth?
There are some medication that I have been trying, Vaseline, if I'm not mistaken.
Vaseline, you put in your mouth.
That I think it's this Vaseline, if I'm not
Okay.
mistaken.
I heard about gargle the salt water and is it effective?
Oh yeah.
I think so, I have tried before.
Then just now you say the ulcer can be caused of the sharp thing punctured to your mucous membrane. It can be other cause or not?
It has a very causes, but it depends. Mostly it's because of some injured that make the bacteria in your mouth have a higher level of virulence than your coverage system. I mean your immune system level is down, and then the other bacteria can get more strong.
Usually, normally, if it is caused, normally ulcer can be caused by termite or not.
Can you repeat again?
I mean, termite can affect ulcer to occur or not.
Yes, I think so.
So, can I start?
Yes, yeah.
So, as we know, pathology is the study of disease, right? So, disease occurs when the agent is too virulent, and the cause, which is the animal and the human, has immune system depression. So, the example of the disease that I want to share with us, because most of us might experience this disease, is Aedes fever. Aedes fever, when we get Aedes fever, usually we will get high body temperature, itchy, and back pain. So what differentiate it from the normal fever is that when we get Aedes fever, sometimes we will get cold, sometimes we will get hot. So the disease, the Aedes fever, is usually transmitted by the biting Aedes mosquito, and the fever can also infect the other human because of the mosquito.
Like, can I ask something? What is the lesion that you get when mosquito bite you?
Lesion. Like we get swollen like this.
Right.
The shape must be circumscribed.
Okay.
I guess you get red spots all over your body. No?
Then I wanna ask, can Aedes fever transmitted by other types of mosquito? No.
Okay, that's it. So that's it. Our discussion about pathology in our everyday life. And thank you.
Thank you.
Thank you.